Diabetes mellitus, Part 2, Diabetes mellitus, Diagnostic testing and stabilizing the patient. In the first section, we discussed the disease processes involved in diabetes mellitus and the effect this illness has on the body when untreated. Here, we will take a look at the laboratory results that confirm a diagnosis and the initial treatment regimen employed on the presenting diabetic. It should first be said that any disease is easier to treat when detected early in its progression. For the chronically unmanaged diabetic patient, much deterioration in the overall health has already occurred, making treatment of the disease more difficult. By the time symptoms are obvious, the disease is already well established. Routine wellness exams greatly improve early detection of diseases like diabetes. Upon presentation of a symptomatic animal, the veterinarian will give the pet a complete physical examination and collect blood and urine for analysis. A complete blood cell count and chemistry panel, along with the urinalysis, is required as a baseline workup. A urine culture is also commonly needed. Elevated blood glucose and glucosuria, or glucose present in the urine, is evidence of diabetes. Other laboratory test results that return outside of the normal range may indicate the deteriorative effects of diabetes, such as dehydration, kidney disease, pancreatitis, and ketoacidosis, a life-threatening emergency condition caused by untreated chronic diabetes. This shows the importance of combining patient history with initial and follow-up laboratory results when diagnosing an illness. Stress may artificially elevate blood glucose, causing suspicion of diabetes when it does not exist. In times of stress, hormones are released that signal the body's metabolism to release glucose from cellular storage and inhibit the activity of insulin. This gives the body additional energy reserves during periods of stress where food may become unavailable. A blood test called fructosamine is sometimes used to assess whether glucose has been elevated over a longer period of time. It may be useful to measure a patient's response to treatment when blood glucose readings are unreliable because of stress-induced artifact. Initial treatment of the presenting diabetic. Dehydration and electrolyte imbalances should be corrected with intravenous fluids in order to stabilize the patient. Ketoacidosis, diagnosed by finding elevated ketone bodies in the urine or bloodstream, must be corrected immediately and aggressively. Ketone bodies are a toxic byproduct of fat metabolism that occurs when cells are chronically starved for glucose and must rely on fat stores as a primary source of energy. Normally, a small amount of ketones are present in the blood and are used for fuel by the brain during fasting. An elevated level of ketones, called ketosis, can upset blood pH and cause ketoacidosis, blood pH that is dangerously acidic. Correcting ketoacidosis is achieved by diuresis, or increasing urine production with a pH-buffered crystalloid fluid such as 0.9% saline or lactated Ringer's solution. Insulin is then administered to reestablish glucose metabolism. Sodium bicarbonate and antacid may be given through IV with caution in extreme emergencies. However, its use remains controversial and is generally avoided except as a last resort. Secondary and coincidental disease processes are addressed at this point. A urine culture may be performed, and antibiotics may be started in the case of urinary tract infection. Presenting diabetes is treated both symptomatically and by starting insulin supplementation. Almost all diabetic dogs require insulin injections, as they will have type 1 diabetes, a deficiency in the production of insulin. Some cats may respond well to diet change. More on diet's role in diabetes to follow, and oral glucose-controlling drugs, at least initially. Most cats will eventually require insulin injections as well. However, cats may experience transient diabetes, where they require insulin for a period of time and suddenly reverse their diabetic status. When insulin is given, a pre- and post-injection blood glucose will be checked to measure the resting level and response. The dose is adjusted until a desired effect is seen. This is called a glucose curve. A 24-hour glucose curve is ideal, but not always possible. Blood samples are collected every 2 to 4 hours, and glucose is measured and recorded. Ideally, Blood glucose levels should be maintained between 80 and 200 milligrams per deciliter. This may require the owner's assistance by teaching them to check the pet's glucose at home with a portable glucometer. It is important to properly educate the owner and establish good documentation if these readings are to be relied on when adjusting the insulin dosage. When beginning insulin therapy and after making dosage adjustments, it may take several days for the glucose curve to stabilize and become predictable. Changes in feeding times, diet, environmental stress factors, injection technique and timing, and other variables can all cause variations in the daily glucose curve. Adjustments to insulin dosage should be made in small increments over time until the best response to therapy is seen. In the next section, we will discuss educating the client in the proper administration and storage of insulin, at-home monitoring and reporting of glucometer results, and steps to take in case of insulin overdose or hypoglycemia.